I would like to call Dr. Prashant Kumar. So he will be speaking on association between serum and aqueous lipid concentration in age-related cataract.
Good afternoon, everyone. My name is Dr. Prashant Kumar, GR2. I will be presenting the association between serum and aqueous lipid concentration in patients with age-related cataract. Introduction. Age-related cataract is a complex disease with multiple risk factors like high myopia, diabetes, obesity, blood pressure, and dyslipidemia. Among these, obesity, blood pressure, and dyslipidemia have consistently been associated with blood lipid concentration. Some studies have suggested that blood concentration is an increased risk factor for cataract, while others shows no association. The aims and objective is to measure the serum and aqueous lipid concentration in patients of age-related cataract and to correlate the serum and aqueous lipid concentration with the type of cataract, and to compare the aqueous lipid concentration in cataract patient with normal serum lipid profile versus deranged lipid profile. The material methods are, the study was conducted in the Department of Ophthalmology, Gandhi Memorial Hospital, SSMC Rewa, Madhya Pradesh. Duration was from November to August 2025. It was a cross-section interventional study, and study population was 25 cases of age-related cataract. The inclusion and exclusion criteria are, all the patients with age-related cataract, and exclusion criteria are any cataract other than age-related cataract, such as patients with previous history and treatment with lipid abnormality, patients on lipid lowering treatment, any chronic and metabolic disease, topical or systemic steroid, patients with renal and liver dysfunction, smokers and alcoholic. The patient's procedure was, patients will undergo visual acuity testing, slit lamp examination, tonometry and fundus examination. Type of cataract will be graded on slit lamp, and patient will be divided into 3 groups, such as nuclear sclerosis, cortical cataract, PSC. Blood samples will be obtained in the early morning on the first day of admission after overnight fasting, and serum lipid profile was estimated, and depending on the report of serum lipid profile, patient will be divided into 2 groups. One group with those with normal lipid profile and those with a deranged lipid profile. And the aqueous lipid profile will be done by drawing the aqueous sample intraoperatively. Anterior chamber paracentesis will be performed, and 0.2 ml of aqueous humor will be withdrawn using a tuberculin syringe. This was the result, showing the regression analysis of the aqueous total cholesterol and the serum total cholesterol. Second is that of the aqueous total cholesterol and the serum HDL. The third is the aqueous total cholesterol and serum LDL, and the fourth is the aqueous total cholesterol and the serum triglyceride. The total cholesterol versus aqueous cholesterol, the regression coefficient is 0.314 and p-value of 0.1, which shows a positive trend and borderline significance. HDL versus aqueous cholesterol shows a negative trend but is not significant. The rest of the LDL and the triglyceride shows no association at all. So interpretation of the result is that none of the serum lipid parameters shows a statistically significant correlation. The strongest but still not non-significant relationship is seen between the serum total cholesterol and aqueous total cholesterol. Discussion is, literature is mixed but suggests biological possibility that lipid and cholesterol metabolism affect lens and aqueous lipid composition and potentially cataractogenesis. Several epidemiological studies and review reports report that there is association between dyslipidemia and cataract risk in some population. And animal and biochemical study supports a role for cholesterol and the lipids in the lens biology. The limitation of this study is that the sample size was small and confounder not adjusted, age variability, sex, BMI, smoking were not controlled. Single parameter for ocular lipid was considered, and cross-sectional design of this study. So we cannot infer the causality or the temporal sequence. Conclusion of this study is that oxidative stress from high lipid level accelerate the cataract formation. Diabetic individuals are especially vulnerable due to elevated lipid and glucose level. Lipid lowering strategies such as diet, exercise, and medication helps to reduce the oxidative damage. Antioxidant and lipid control stabilizes the lipid lens protein and maintains the lens transparency. Preventive approach may delay or reduce the need for cataract surgery, and lipid regulation supports both cardiovascular and ocular health. And these are the references for my study.
Thank you, Dr. Prashant. It was a nice presentation. I just wanted to ask you, what are the inclusion criteria? So, like you have excluded all the patient with any kind of, they are taking any anti-lipidemic drugs.
Any dyslipidemic drug, whether they are on statins, whether they have diabetic, hypertension,
any kind of systemic.
Only those patients with age-related cataract were considered for us in study.
Okay, fine. So you have done all the pre-operative investigation for the patients.
Just mostly lipid profile was, all the pre-operative investigation was done, and also history and clinical examination was done, and all those patients with metabolic diseases and patients on any medication like lipid lowering or diabetic or hypertension, all those patients was eliminated from the inclusion criteria.
Okay. So do you think any like duration matters in these type of like cataracts? If you see the raised levels of cholesterol, but it happens in a the patient is like having hyperlipidemia from last 1 year, or a patient with having a hyperlipidemia from last 10 years. So do you think the duration matters in these cases?
Yes, of course.
So I think your sample size, I think you should
Yes, sir.
have a good sample size, and next thing you can do a long follow for the same to get a good results on the your
Yes.
study. It was a very nice study, nicely done by you guys. Thank you. Thank you, Prashant. Thank you for your.
Thank you, sir.